This video is for general information only and is not a substitute for professional medical advice. Always speak with a qualified UK-registered healthcare professional before considering any new treatment. So, what is the correct dose for a subcutaneous NAD plus injection? Here's the honest answer: there isn't one. There are no standardized, evidence-based dosing protocols for NAD plus subcutaneous injections approved by UK regulatory authorities, and that's actually the most important thing to understand about this topic. Let's break down what that really means and why it matters for you. NAD+, or nicotinamide adenine dinucleotide, is a coenzyme found in every living cell. It plays a central role in how your cells produce energy and repair DNA. Your body naturally produces it, but levels do tend to decline with age. That's partly why there's been growing interest in NAD plus supplementation, including via injection. However, it's important to be clear: robust clinical evidence for the therapeutic benefits of NAD plus supplementation in humans remains limited. Most available data comes from preclinical studies or small-scale trials, and there is currently no NICE guidance recommending NAD plus supplementation for any medical condition. Subcutaneous injections deliver a substance into the fatty tissue beneath the skin, bypassing the digestive system. But here's something really important: the pharmacokinetics of subcutaneous NAD+, meaning how it's absorbed, distributed, and processed by the body, have not been well characterized in clinical studies. So even the absorption patterns are largely theoretical at this stage. From a safety and regulatory standpoint, NAD plus subcutaneous injections are not licensed medicines in the UK. They do not hold MHRA marketing authorization. If prescribed at all, they can only be legally supplied as an unlicensed special, and only on a prescriber's direct responsibility through an MHRA licensed manufacturer. There is no established dose-response relationship and no proven clinical outcomes for this route of administration. The British National Formulary contains no monograph for NAD plus injections, which reflects that unlicensed status. Self-sourcing NAD plus products online or self-injecting is not recommended. This is not something you should pursue without the direct involvement of a qualified UK-registered prescriber. If you're experiencing symptoms like persistent fatigue or brain fog that have led you to look into NAD+, the right first step is to speak with your GP. It's important to have an appropriate NHS assessment to investigate any underlying causes before considering unlicensed treatments. Your symptoms deserve a proper diagnosis, not a workaround. If a registered prescriber does consider NAD plus therapy appropriate for you, they will take into account your individual circumstances and take full clinical responsibility for that decision. You should never be taking any dose without that professional oversight in place. In terms of side effects, local reactions can include pain, redness, swelling, and bruising. Systemic effects that have been reported include flushing, nausea, and headache. If you experience any adverse reactions, please report them to the MHRA via the yellow card scheme. The link is in the description below. That reporting genuinely matters, as it helps build the safety picture for unlicensed treatments like this one. So, to recap, NAD+ is a coenzyme involved in cellular energy and DNA repair, and levels do decline with age. But subcutaneous NAD+ injections are not MHRA licensed in the UK. There are no approved dosing guidelines, and the clinical evidence for benefits remains limited. If you're curious about this treatment, please speak to a qualified healthcare professional first, and make sure any underlying health concerns are properly assessed through the NHS. Have questions about NAD plus therapy or unlicensed treatments? Drop them in the comments below. We'd love to hear from you. And if you found this video helpful, please give it a like and subscribe to the Bolt channel for more honest, medically informed health content.